A return to lockdowns? How would you guys feel about that? Well, I'm just saying, prepare for the worst, just in case, right? Because sources are saying that they're trying to bring it back. And I may just know why, but that's for later in today's video. I heard from somebody who's working in a sign company. They said that they have been instructed to mass produce C19 signs for stores, basically bringing things back like social distancing as well as the masking. Now, I heard as well that Dollar General is going to be bringing back masks and social distancing on September 15th. Already, mainstream media outlets, they're talking about this whole new C19 variant that's pushing up cases right here in the United States. Check it out, guys.
Well, there is a new coronavirus variant that is causing more new COVID cases across the country than any other variant, according to the CDC.
Yeah, in today's Health Minute, Mandy Gather has more on EG5 and what you can expect from it.
It's being called a variant of interest by the World Health Organization. EG5 is another Omicron offshoot and behind about 17% of new COVID-19 cases in the U.S.
So for now, it seems that it may have increased transmissibility, but it does not seem to be posing more of a threat to public health than other variants.
So far, EG5 has been detected in 51 countries, its global presence doubling over the last month, with China having the largest portion, about a third of reported cases, followed by the US, South Korea, Japan, Canada, Australia, Singapore, and the UK at 2%. EG5 was upgraded from a variant under monitoring because global health officials believe it should be tracked and further studied, says Dr. Audie Shaw with Mayo Clinic.
So that we can keep an eye on the data and make further determination as to if this is more risky or leading to more hospitalization.
Right now, the U.S. is seeing a rise in COVID-19 cases, emergency room visits, and hospitalizations, but it's unclear if this specific strain is driving those increases. Health experts believe the record heat driving people indoors and summer travel may be helping to drive the uptick. An updated COVID booster is expected by fall.
It's because the booster is targeted against XBB, and which is the strain of the Omicron family that EG5 is related to or comes from. So potentially it should protect against EG5 as well.
For Health Minute, I'm Mandy Gaither.
So a friend of mine who works at a very large health insurance company, they just got an email for mandatory pandemic training next week. They didn't specify if it was for the you know what I'm saying? But I don't know, guys. I thought pandemics were only occurring like every 100 years or so. So what do you guys think? Something else definitely smells fishy here. Now, with the late summer spike in the C19 cases, mask mandates are starting back up in some places. And I've seen them in some schools, hospitals, and even businesses encouraging and even some requiring people to start masking up again. Now, the most recent CDC data from earlier this month shows nationwide C19 hospitalizations increased by nearly 19% in a single week, and deaths have increased by more than 21%. Now, apparently, recently up to 10,000 people a week have been hospitalized with C19. But hey, that is far fewer than the 40,000 such hospitalizations per week that the United States had at the highest point last August. So hopefully our stronger immunity and the tools that we're already using will be enough without them actually having to drag us back into this whole lockdown situation. You know what I'm saying? But then again, they still warn about the exact same thing. C19 remaining risky for people who are unvaccinated, especially unvaccinated individuals who haven't gotten the virus before, and those who are older or have underlying health conditions. They say that about 70% of hospitalizations are among those who are 65 years old and older. Public health officials have their eye on two new variants, guys. The Omicron variant EG.5, which is nicknamed Iris, it's become dominant in the United States, while BA.2.86 is starting to spread. Now, Iris is supposedly more transmissible than other variants, though it doesn't appear to cause more severe disease. And the CDC warned just last week that the BA.2.86 may be more capable of causing infection in people who have previously had the C19 virus or vaccines, though they don't believe that it's causing more severe illnesses either. So again, why the need for more lockdowns? I don't get it, guys. So here's what I got so far. Morris Brown College, a historically black college in Atlanta, announced last weekend that it would restrict gatherings and implement a mask mandate for 2 weeks due to reports of positive cases among students. Now, Hollywood Studios' Lionsgate briefly required employees to wear masks on 2 floors of its 5-story office building. The healthcare company Kaiser Permanente reinstated a mask mandate at its Santa Rosa, California facilities after an uptick in patients testing positive. So did several hospital systems in New York State, including United Health Services, Auburn Community Hospital, and Upstate Medical. Now, Upstate Medical University in Syracuse, the largest employer in central New York, announced in mid-August that it will require all staff, visitors, and patients to wear masks in clinical areas for at least 3 weeks. And some places are strongly encouraging people to return to masking, even if they're not requiring it. So the Talladega City School District in Alabama is urging students to wear masks. Now they call it not a mask mandate, but a general encouragement to be more conscious of our health. Now in the same state, Kinterbish Junior High School, they're asking students, staff, and visitors to wear masks due to rising case counts. Politicians are also standing up and they're saying that they're not bringing back the mask mandates. Illinois Governor J.B. Pritzker, he recently dismissed rumors that his administration was discussing this possibility. Mississippi Governor Tate Reeves, he said earlier this week that his state will not return to widespread masking or C19 rules, despite a rise in cases, adding that people have a right to make their own decisions. Now, former President Donald Trump also released a very special campaign video on X, formerly Twitter, talking about the fear-mongering of C19 tyrants and pledging that we will not comply with school shutdowns, lockdowns, or even mask and vaccine mandates. Now, if reelected, he said he will cut federal spending to schools, airlines, and public transportation systems that impose mask or vaccine mandates. What do you think about this, guys? Get your free home warranty quote. There's a link in the description down below this video. Never, ever, ever be caught off guard by another very expensive home repair again. Get your free home warranty quote. There's a link in the description down below this video. But seriously, guys, for me, I think that, these things, these vaccines, these masks, social distancing, they're a personal decision for each and every one of us. Basically, people should weigh how much risk that they're willing to take personally and modify their behavior as things change, including a rise in cases. A lot of financial decisions go with what's best for you, what's best for your family, and what's best for your situation. Y'all know what I mean, right? So for example, you may want to mask up in crowded settings while traveling if you happen to be immunocompromised, or if the person next to you seems like they're sick. How much does this help? I can't really call that, but some suggest getting in the habit of bringing a mask with you, just in case you need to make an impromptu decision. Now, as always, I'm here to give you guys the facts of the matter and what's really happening on the ground with these things. Now, what I do recommend is you subscribing to the channel and lighting up that like button. Definitely helps out to get this information that the mainstream media doesn't necessarily pick up on. I mean, am I right, guys? We are all one big financial freedom fam here, so let's take care of one another. Now, I thought it would also be good to cover some of the recent C19 hotspots right here in the US. So this is based on the latest hospitalization rates from the CDC. The US tallied about 15,000 reported hospitalizations of people with C19 over the 7 days ending August 19th. Now, of course, this is nothing when you compare it to the C19 highs from before, but still, it's a 19% increase from the week prior, and it's continuing to climb. And this climb started at the end of June after hospitalizations reached a recent weekly low point of approximately 6,300. Now, relative to population, the latest tally equates to about 4.5 people per 100,000 people admitted by the hospital. Now, by state, Hawaii and Florida saw the highest rates of new C19 hospitalizations, sitting at 9.8 and 9.7 per 100,000 people respectively, more than twice the national rate. Louisiana sitting at 6.6, Alabama at 6.5, and Mississippi at 6.5 had the next highest rates. Now, the counties with the highest rates of C19 hospital admissions per 100,000 people were Lamar County in Alabama, 26.4, Clay County, Mississippi, 26.4, Loudons County, Mississippi, 26.4, Noxubee County, Mississippi, 26.4, Fisher County, Texas, 25.8, Mitchell County, Texas, 25.8, Nolan County, Texas, 25.8, Jefferson County, Georgia, 19.6, Washington County, Georgia, 19.6, Claiborne Parish, Louisiana, 19.1. Fillmore County, Nebraska, 19.1. Thayer County, Nebraska, 19.1. And I'm gonna just let you guys see what's on the screen here. There's a lot going on here. And it might not sound that big, but even a relatively small number of hospitalizations in a small community, it could lead to a significantly higher hospitalization rate. Now, data shows that hundreds of people have died in connection with C-19 as of late. Maryland and Florida each saw 3.4% of their total deaths attributed to C-19 during the week ending August 19th, doubling the national percentage. So yeah, they're gonna have to just freak us out, like scare us with the most extreme headlines and just a barrage of news. So we're gonna get hit hard and feel like we have to take these steps again. I say just watch out for the fear mongering and the government selling, guys. Otherwise, we could very well find ourselves back in C-19 lockdowns like before. Now, another part of the pandemic era that I really don't miss, but it may be coming back again. Shortages, specifically medicine shortages. Now, let me know if you guys have been noticing anything like this in your area. I had to get an antibiotic for my son the other day. So they said at the ER that it was at Rite Aid. So I went there and it looked like a bank run on meds. The line was long to get it. They didn't have it, so I went to CVS. Once again, a long line inside and through the drive-thru. Now I said to the pharmacist, it looks like a bank run on the meds. She said that they were getting Rite Aid scripts from people coming in saying that they could not get their meds, out of stock. So when I heard that, I went back to Rite Aid just because I wanted to know. Pretty much the same answer there. So I feel like the shortages are getting worse and worse, and people are pinballing pharmacies just to get their meds. Also, CVS told me that they were 1 week plus on filling orders. Definitely makes me wonder what the heck is really happening here. Like, is this a national shortage or something man-made here? Maybe something about the pharma companies? You know what I mean? I don't know. I mean, just take a look here. Prescription drug shortages are nearing record levels across the nation, and shortages are being felt by pharmacies and hospitals locally. Now, among the drugs in short supply right now, it's amoxicillin for children, a drug used since 1974 in the United States. It is now so hard to find. Just in July, pharmacists nationwide reported 309 drugs in short supply. Some cancer drugs are also in short supply. So it's so serious that Homeland Security called the shortages a risk to the nation's health and a national security risk in this March report. Pharmacists advise if you have a medicine that you suspect may be in short supply, call your pharmacy before heading out to get it filled. You know what? Maybe we need a shortage of politicians worldwide. I mean, the political theatrics, they just continue. Remember how in the first part of this video, I said, I may have an idea as to why politicians would want to go back to the C-19 lockdowns? Well, this headline may have something to do with it. Former state senator accused of spending C-19 relief loan on luxury cars. So a former state senator was accused of lying in order to get a C-19 relief loan for his casino and then using this money to buy luxury cars for himself, for his wife, and a Republican leader in the New Hampshire House. Now, I'm talking about former state senator Andy Sanborn. Federal authorities have been notified and the state has already begun a criminal investigation. Now, according to the investigation, Sanborn fraudulently obtained $844,000 in funding from the Small Business Administration between December 2021 and February of 2022. Allegedly. Now, casinos and charitable gaming facilities, they weren't eligible for such types of loans, but Sanborn omitted his business name, Concord Casino, from his application and listed his primary business activity as miscellaneous services. He's also accused of spending $181,000 on 2 Porsche race cars and $80,000 on a Ferrari for his wife. Now, I'm not sure what kind of Ferrari he was able to find for $80,000. Maybe it was an older one, but nevertheless, Sanborn also allegedly paid himself more than $183,000 for what he characterized as rent for his Concord property. So yeah, some politicians, they've got some sort of interesting financial interest in the return of lockdowns, wouldn't you say? You guys tell me.